Have you ever wondered if a medication you're taking might be slowly damaging your brain? Imagine this: the very drugs prescribed every day to millions of people for issues as common as heartburn, pain relief, or insomnia, could be linked to long-term cognitive decline. If that sounds alarming, it should be. Even more surprising, many doctors themselves avoid these same medications. Why? Because they know something the general public often doesn't. What if I told you that 5 commonly used medications, sitting in many medicine cabinets, have serious long-term risks, including increased chances of developing dementia? Today, we'll reveal what these medications are, explain why doctors steer clear of them, and share safer alternatives. Stick around, this information could change how you manage your health. 1. Proton pump inhibitors, PPIs. Let's begin with a class of medications that's widely used but has some concerning long-term effects: proton pump inhibitors, or PPIs. These drugs, which include popular brands like omeprazole, Prilosec, and esomeprazole, Nexium, are often prescribed to manage conditions like heartburn, acid reflux, and gastroesophageal reflux disease, GERD. They work by blocking an enzyme in your stomach lining to reduce acid production, which helps alleviate symptoms. While PPIs are highly effective for short-term use, studies have shown that prolonged usage is linked to significant health risks, including a 44% increased chance of developing dementia. How does this happen? PPIs can lead to nutrient deficiencies, especially in vitamin B12, a critical nutrient for brain function. When B12 levels drop, nerve function can be compromised, leading to cognitive decline. Additionally, PPIs disrupt the balance of good bacteria in the gut, which can cause chronic inflammation. Over time, this inflammation can travel through the bloodstream and affect your brain. The gut-brain connection is a vital part of overall health, and long-term disruption can have far-reaching consequences. Before you reach for a PPI, consider if you really need it or if there are alternative ways to manage your symptoms. Simple lifestyle changes like eating smaller meals, avoiding late-night snacks, and reducing caffeine and alcohol intake can make a big difference. If medication is necessary, talk to your doctor about the lowest effective dose and limit the duration of use whenever possible. 2. Benzodiazepines. Benzodiazepines, or benzos, are commonly prescribed for conditions like anxiety, insomnia, and seizures. Drugs like Xanax, Valium, and Ativan are often used because they provide quick relief by calming the nervous system. However, while these medications are effective for short-term use, they can become highly problematic if taken for extended periods. One of the biggest concerns with long-term benzodiazepine use is its association with a higher risk of dementia. Why does this happen? Benzos work by enhancing the effect of a neurotransmitter called GABA, which slows down brain activity. While this helps reduce anxiety and induces sleep, over time, it can lead to dependence and altered brain function. Essentially, the brain becomes accustomed to the medication's effects, and when it's not present, cognitive decline can set in more rapidly than it would naturally. Research shows that prolonged use of benzodiazepines can impair memory, concentration, and decision-making abilities, even increasing the likelihood of permanent cognitive damage. The risk is so significant that many doctors avoid taking these medications long-term themselves. But if you're struggling with anxiety or insomnia, what are your options? Rather than stopping benzos suddenly, which can be dangerous, talk to your doctor about a gradual tapering plan. Additionally, consider non-pharmaceutical approaches like cognitive behavioral therapy, CBT, meditation, or lifestyle changes that can reduce anxiety and improve sleep naturally. Remember, while benzos might seem like a quick fix, the long-term consequences can be far more damaging than the symptoms they're meant to treat. 3. Statins. Statins are among the most commonly prescribed medications worldwide, primarily used to lower cholesterol levels and reduce the risk of heart disease. Medications like atorvastatin, Lipitor, and simvastatin, Zocor, are household names for millions who rely on them to keep their cardiovascular health in check. But while statins are effective at managing cholesterol, there's growing concern about their long-term effects on brain health. You see, cholesterol isn't just a villain that clogs arteries, it's also a vital component for your brain. Cholesterol is necessary for building cell membranes and producing certain hormones that are essential for healthy brain function. Some studies suggest that statins can cross the blood-brain barrier and interfere with cholesterol production within the brain, potentially affecting memory and cognitive function. In fact, research has shown that people taking statins long-term may have a higher risk of experiencing memory problems and cognitive impairment. While not everyone on statins will develop these issues, the association is strong enough that it's worth considering alternatives, especially for those without significant heart disease risk factors. But what does that mean for someone who's been prescribed statins? Should you stop taking them? Not necessarily. The benefits of statins for individuals at high risk of heart attack or stroke usually outweigh the risks. However, for those with moderate or low risk, lifestyle changes such as a healthier diet, regular exercise, and weight management may be safer ways to control cholesterol levels without compromising brain health. If you're currently on statins and have noticed changes in memory or mental clarity, bring it up with your healthcare provider. A medication review can help determine if adjusting the dosage, switching to a different type of statin, or exploring other non-drug options might be the right move for you. 4. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs, or NSAIDs, are go-to medications for managing pain and inflammation. From a headache to joint pain, many of us have turned to NSAIDs like ibuprofen, Advil, Motrin, or naproxen, Aleve, at some point. They're effective, readily available, and often used without a second thought. But while NSAIDs can offer relief in the short term, they come with some hidden risks, especially when used frequently or for long periods. One of the primary concerns with NSAIDs is their impact on cardiovascular health. Prolonged use of these drugs has been linked to an increased risk of high blood pressure, heart attacks, and strokes. This is because NSAIDs can reduce the production of prostaglandins, chemicals that protect blood vessels and maintain healthy circulation. With blood flow compromised, there's a higher chance of reduced oxygen reaching the brain, which in turn can contribute to cognitive decline and dementia. Additionally, NSAIDs can damage the stomach lining, leading to ulcers and gastrointestinal bleeding. They can also cause kidney damage when used excessively, further increasing the risk of cardiovascular complications. These effects combined make NSAIDs a risky choice for chronic pain management, especially for those already at risk of heart or brain health issues. So, what's the alternative? For managing chronic pain or inflammation, consider natural remedies like turmeric or ginger, both of which have anti-inflammatory properties. Supplements such as omega-3 fatty acids can also help reduce inflammation. And if NSAIDs are necessary, use them sparingly and under a healthcare provider's guidance, keeping the duration as short as possible. Remember, while occasional use may be safe, long-term reliance on NSAIDs can carry serious health consequences. 5. Anticholinergic medications. Anticholinergic medications are a diverse group used to treat a variety of conditions, including allergies, depression, and bladder control issues. Common examples include antihistamines like diphenhydramine, Benadryl, certain antidepressants like amitriptyline, and medications for overactive bladder like oxybutynin. They work by blocking the neurotransmitter acetylcholine, which helps control functions like muscle movement and memory. While this can be beneficial for certain medical conditions, the long-term use of anticholinergics has been linked to some serious health risks, particularly when it comes to brain health. Research has shown that regular use of anticholinergics, especially in older adults, can increase the risk of dementia by up to 50%. This is because acetylcholine is crucial for cognitive function, and blocking it over long periods can impair memory, learning, and attention. The result? An accelerated decline in mental sharpness that can sometimes be irreversible. It's not just dementia that's a concern. People who use these medications frequently may also experience confusion, blurred vision, and even hallucinations, all of which can mimic the symptoms of more severe neurological disorders. It's no wonder that many doctors avoid prescribing anticholinergics for themselves or their loved ones, especially as they age. If you've been using anticholinergic medications long-term, it's worth having a conversation with your doctor about safer alternatives. For example, non-drug therapies for bladder issues or newer antidepressants that don't carry the same risks may be viable options. By being proactive and informed, you can take steps to protect your cognitive health and avoid the pitfalls associated with these commonly used medications. Remember, medications can be life-saving, but they can also come with hidden risks, especially when used long-term without a full understanding of their potential side effects. The key takeaway is to be informed. Ask questions, do your research, and don't hesitate to discuss alternatives with your healthcare provider. Staying proactive about your health can make all the difference. With that said, thanks for watching, and until next time.